The US government's sudden decision to axe funding for HIV programs is a wake-up call for South Africa. The country's health minister says the cuts could lead to deaths, but he had instructed state-funded clinics to assure no patient went without life-saving drugs. There is chaos as many affected organizations scramble to find alternative help for some 900,000 HIV patients by the end of the day. Here's a report.
At a rural village in South Africa's KwaZulu-Natal province, unemployed 19-year-old Nozuko Majola is trying to figure out if she has enough money for the one-hour ride to collect her much-needed HIV medication. Usually delivered to her home that can't be easily reached due to rough, untarred roads. Majola is one of millions of patients in South Africa affected by U.S. President Donald Trump's global foreign aid freeze, raising worries about HIV patients, defaulting on treatment, infection rates going up, and eventually a rise in deaths.
I didn't feel good when I heard that funding had been stopped. It's very painful because a lot of people will not go to the clinic. A lot of people already don't like going to the clinic, although they also don't like having their medication delivered due to shame and stigma. I'm not sure what they are afraid of. So I would like for funding to be reinstated so we can continue be assisted and for people not to end up defaulting.
Community members in Everton, south of Johannesburg, gathered at the Mthojeni Awareness Center to collect food parcels donated by South Africa's Department of Social Development. Mthojeni Awareness Center is a non-governmental organization that specializes in orphans and vulnerable children as a result of the HIV pandemic, and also has other programs to help women and youth in the community. The NGO is one of many that have been affected by the President's emergency plan for AIDS relief and USAID freeze by U.S. President Donald Trump, which has left many of their staff and beneficiaries worried about the future. Many Africans had known that Trump's America First outlook meant their continent was likely to be last among his priorities. But they hadn't expected the abrupt halt to foreign aid from the world's largest donor that stops money flowing for wide-ranging projects like disease response, girls' education, and free school lunches.
Who will help us following this aid crisis? It won't be easy. Life won't be as normal like it used to.
I would be happy if the American president, Donald Trump, stops the whole crisis and takes things back to normal, because I don't think he is aware that the funding was helping us and the beneficiaries of the funding. We are here because of the beneficiaries, as they are the ones who are greatly affected.
South Africa's leading AIDS lobby group, the Treatment Action Campaign, warned the country could see a return to when HIV patients struggled to access necessary services for their treatment. Several of the largest U.S.-funded HIV/AIDS programs in South Africa were told that their funding would not resume. Some of the programs that were cut in South Africa provided HIV/AIDS services to vulnerable groups such as LGBT+ people and sex workers, as well as testing and care services to the general population.
We stand to lose all the investment over the last 25 years if we do not work hard to fill the gaps that this funding freeze is causing. Secondly, we will see lives lost. So in excess of 500,000 unnecessary deaths will occur because of the loss of the funding, and up to 500,000 new infections. So these are modeling studies. They are prone to various assumptions, but just to give the flavor that this is not going to be business as usual.
South Africa has the world's largest number of people living with HIV at around 8 million. Africa Bureau, WION World is one.
For all the latest news, download the WION app and subscribe to our YouTube channel.